Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
I do want to emphasize that our processes, whether it's in dealing with this pandemic or other aspects of public health that we address, a major part of that is taking into consideration and getting feedback and input from stakeholders and the community. There's a reason that it's called public health. And our approach to public health is one where we emphasize the public. And that means that our risk assessment and risk management steps is centered around science and data. In terms of risk management and risk reduction approaches, it is very important to understand our community, our school districts in this case, and figure out how to work together to do this. To reduce the risk associated with this pandemic, we need our teachers. And teachers are concerned. They have their fears about COVID-19. They're not quite as young as the students. They're also afraid that students might spread infections to them, and that is a real consideration that we have to consider. We have parents that are mixed in how they feel. There are parents that are worried about infections, about their children bringing infections home. We also have parents that are worried about the impacts of their children not being able to participate in activities or be in person. All of those are there. And so when we say we take input into consideration, it means that we talked with different people. We talked with other public health directors in the region. We talked with Mid-America Regional Council. We spoke with other experts around this place and obviously across the country to see what school districts are doing and make recommendations around that. Again, because we are dealing with a new pandemic and we're in a territory that we haven't been before, we have to understand that our approaches and our recommendations would change with time. And some of them would work, some of them will need further adjustments to work. But I remain convinced that if we all work together, if we all wear masks, if we respect that this virus is here, and that what we do will determine whether it's controlled or it spreads by avoiding restaurants, bars, and crowded events, by us parents monitoring symptoms in our children, and if they're sick, ensuring that they stay home, by ensuring that we work with our public health professional. If you get tested and you are called that you are positive, we need you to work with us to identify your contacts so we can put them in quarantine and stop the spread. We need to continue to do what our businesses have been doing for these several months, requiring people to wear masks before they come in. And I'll tell you, that's really responsible for a lot of where we are, that we haven't lost control of the virus thus far. And so if we all play those roles together, we can begin to move more towards what life used to be. Obviously, the good news on the national scene is that we're moving towards the latter stages of vaccine availability. And if vaccines become available, it will be easier for us to reach herd immunity, and we can get back to living lives the normal way. However, I do want to emphasize that even when it seems like we all have different opinions, as your local public health department, we are listening to you. We're getting input from your superintendents. We are talking to your school boards. We're talking to KDHE. We're talking to different people. And the goal is to make what we feel is the best decision for everyone.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.